Hello, ladies and gentlemen. Welcome to NL Media. This is We the People Media, so by the people, for the people. And we got a good one for you tonight. We have proof, and again, we're streaming on Facebook, so we have to be very coy with our language. Proof that doctors have been paid off, financially incentivized to provide vaccines to their patients. Now, I'm old enough to remember, and I'm young. I get it. I'm only 33, but I'm old enough to remember when there were conspiracy theorists that were floating the idea that the medical professionals were being paid off, and they didn't mean these top dogs that were giving the orders. They meant the regular household physicians that seemingly were pushing this on people. I know people in my personal life who were pregnant, and while pregnant, were told by their OBGYN, I think it is, I might have the letters mixed up there, about getting a flu shot and both 1 and 2 COVID shots during their pregnancy. So I'm old enough to remember when that was a conspiracy theory. Now, we have documents here that we're going to look at on screen from Blue Cross Blue Shield, a healthcare provider in the United States. The document we're going to look at is specifically from the state of Kentucky. And we're going to look at the incentive program they've offered their doctors. And it's very, very upfront. They make no bones about it. There's no sort of hiding this. It's an incentive program. And what tells you, and what the proof in the pudding, I suppose, when we look at this now in a minute, will be the very first paragraph you read. I'm going to put some of this stuff in the comments section for you guys to be able to bring up on your own as well. I will have it up on screen so you don't have to worry, but for your own benefit, you should have this, and you should follow along if you're able to. There's one in the comments there now coming. That's the PDF we're going to be looking at. So with that in mind, before I bring that up, okay, NL Media is we the people, by the people, for the people, and it can only be for the people if it's by the people. So you can see the ticker on the bottom here. You've got a chance to join the stream and have your say. There's going to be a StreamYard link pop up in the comments here now in a second. All you need to do is click that link. You don't even need a camera. All you need is a working microphone, ideally a camera, but you don't need it. If you want to join the stream and have your say, you can tell me I'm right, tell me I'm wrong, tell me what we're looking at is ridiculous. That's what We the People Media is. It's your opportunity to hop in and have your say. Likewise, if you think you have something to contribute to our team, if you like what we're doing, reach out to us. That's enough housekeeping for now. We're going to get straight to it now. So I'm going to bring up the document, Blue Cross Blue Shield incentive program. So here we are. Anthem Medicaid. Anthem Blue Cross Blue Shield Medicaid. Now, the first thing I want to bring to your attention is this very first paragraph. So under where it says COVID-19 Vaccine Provider Incentive Program, which again, like I said, is as in your face as it can possibly be. So it starts off by saying, getting vaccinated against COVID-19 is one of the best and safest ways people can protect themselves and their families against the virus. As a participating practice in the COVID-19 Provider Vaccine Incentive Program, we recognize your hard work by offering incentives for helping patients make the choice to become vaccinated. Now, it goes on to describe the eligibility here, the criteria that one would have to meet in order to qualify for this. Hello, Liz, and we are streaming back on Facebook page, which means I can see your name. You don't even have to introduce yourself anymore. So in the comments, guys, look for the StreamYard link. At any point in the stream, if something you hear pops into your head and you decide, I want to have my say, click that link. You don't come right on the stream. Don't worry. Don't be camera shy. You come backstage one by one. I can let you in. You can have your say. So with that in mind, we're going to keep looking at the document. I just want you guys to just really let that first paragraph marinate, especially the very last sentence. It says, "We recognize your hard work by offering incentives for helping patients make the choice to become vaccinated." Now, in the eligibility section, we're looking at the COVID-19 Vaccine Provider Incentive Program is open to you if you are a participating Kentucky primary care provider with an Anthem Blue Cross and Blue Shield Medicaid, in brackets Anthem, panel size of 25 or more members. So the very smaller practices that had less than 25 patients wouldn't qualify for this program, because they're really looking for numbers here, right? They really want to make sure the majority gets vaccinated. So all Anthem members identified as receiving the COVID-19 vaccine services are included in the methodology, and the vaccine results will be determined by a COVID-19 vaccine claim or by confirmation from Kentucky Vaccine Registry. So this is specifically for the state of Kentucky, we'll point out. So they have 2 time periods that they're collecting this data: September 1st of 2021 and December 31st of 2021. And here's how you qualify for a bonus. Keeping this in mind, guys. If your practice meets meets the below threshold for vaccination within at least 1 dose by September 1st, you'll receive your initial incentive, remember the bonus, payment based on the following rates. And this is, again, and Liz, you're absolutely right. Like incentivizing coercion makes you wonder. It's plain as day bribery. If a physician manages to get 30% of their Anthem members vaccinated, and this is just the 1 dose, they receive a $20 bonus per member. If they get 40% vaccinated, they get $45 per member. 50%, they get $70, so on. Up to 75% of their members vaccinated, they would get $125 per member that got vaccinated. Now, the final calculation, or the final payment, is calculated on members who are newly vaccinated between those 2 dates. And they're looking to see if the financial incentive works. And they have data below to show you whether or not it works to bribe people or not. And I think the majority of people watching this will be able to use their great powers of discernment to figure that one out. If your practice meets below thresholds for vaccination with at least 1 dose by December, this is the second period that they're looking for final incentive payment. Now look at this. If they manage to get at least 30% of their members vaccinated, $100 per newly vaccinated member. Again, the same increments, 30, 40, 50, 60, all the way up to 75%. They would get $250 per vaccinated member. Again, I just, like, at the risk of repeating myself just slightly here, I'm old enough to remember when it was a laughable conspiracy theory that the medical professionals were being paid off or bribed or incentivized to partake in this. Many people, there was many different reasons that people came up with this theory as well. I mean, it's from the fact that there's no possible way that all these doctors were falling in line with something that doctors independently think about everything else all the time, but somehow they seem to all line up behind this one concept. The medical ineptitude that it takes to push this as something that's required is crazy. If you wanted to say that people who are immunocompromised should seriously consider getting it based on the dangers of the virus, that would be one thing. But for you to coerce the entire population and then bribe the medical industry into participating, that's a whole other level. And you want to talk about criminal activity. And Valerie said it. Genocide. You're forcing people to take on an experimental medical practice. That's the nicest way to put it. It was experimental. It is still experimental. And as we're seeing, and we're going to continue to see, the medical field was bribed. There's no other way to put it. It's quite literally offering quid pro quo bonuses for specific amounts of vaccinations. So we've gone over, there's two, you see here, the results will be calculated for 2 time periods. So the first one is September 1st, and then December 31st. And the object is to see if their financial incentives are working. So before they get to that, obviously we need to cover the very important aspect of how the doctors can be paid for their heroic work of receiving money for convincing you to take something you'd otherwise not take. When will you receive your bonus, your bribe? Your first payment will be sent by electronic funds transfer or check based on the payment method used for claim reimbursement, which would vary depending on the clinic and how you operate. And they want you to allow up to 7 to 10 business days to receive your payment. And if you've not received your payment within a time frame, they even have a customer service 1-800 number with option 3 ready for you to press, so that you can clarify where your payment is and how long it's going to take to get to you and all this kind of stuff. So just keep that in mind. It's very clearly, as plain as day, an absolute bribe. And I think I just saw something in the comments, so I'm just going to stop for a second. I don't know if this is going to show up on the screen, Valerie, because it's a long comment, but I'm going to try to display it here. Article 7, crimes against humanity for the purpose of the statute. Crimes against humanity means any of the following acts when committed as part of a widespread or systematic attack directed against any civilian population with knowledge of the attack. Murder, extermination, enslavement, deportation, or forcible transfer of population, imprisonment, or other severe deprivation of physical liberty in violation of fundamental rules of international law, torture, rape, sexual slavery, enforced, ... So we'll just we'll leave it at that. So now we're going to get to the data. This is Appendix A. I believe there's A and B, if I'm correct here. So these are some examples to just so the doctors, these heroic doctors that are going to receive bribes to poison you, just so they understand exactly how the payment works, because these doctors are so busy with their medical profession that they can't do the simple calculation of 30% of my patients, $20 times however many that is. This is how much my bribe check should be. So they've actually broken it down for them. These are examples to help illustrate the COVID-19 provider incentive program payments. So then they show you the percentage of Anthem members vaccinated. And again, it's the same rates, 30, 40, 50, 60, 75. Initial payments for the members per head. This is per head, 20, 40, 70, and the final payment based on that. And you see the final payment here. Now, they also have a change in threshold example, because again, they're trying to show you that if we offer you more money and you happen to get more people, then you're going to get more and more money. That's how this whole compound thing works. So in this example, the change in threshold, they started with 78 vaccinated members and then went up to 105 vaccinated members in the second counting, which was a newly vaccinated members of plus 27. So they had a total of 250 members in their panels. So the vaccination rates were 31% and 42%. So the initial payment started at $1,500 for the initial, but the final payment ended up being $1,500 for the second one. So to add 27 new members gave an extra couple of $1,000s to this hypothetical doctor here. And then they break it down in bullet points because, again, the doctors are so busy with their other heroic medical practice that they couldn't possibly calculate basic percentages. So in this example, they grew their vaccinated panel from 31% to 42%, which added 27 new members, which earned an initial payment of $1,500 because they reached the 30% threshold. But they earned $4,000 in the final payment because they reached the 40% threshold on the secondary counting. And just in case anyone's wondering, this is the official stamp down here for the website that you can go to and check all this out yourself. The link is also already in the comments. And there's one more thing that we're going to... who would ever do that? Sharon, I believe, I don't want to speak for Stone Lee. He's a great big boy. He's a hairy ass man, but I believe he's being sarcastic. So don't take him too seriously there. Before I get to the next appendix to show you the next example of the the heroic doctors and the potential money they could make, there is a StreamYard link in the comment section. I'm going to put it in here again just for the heck of it, and I'll pin it so it shows up at the top. No, I'm not going to pin your comments, only I'll try this one here. If you want to hop in and have your say on what you're seeing now, by all means, you can click that link. You'll come backstage. You don't come right on camera, and I'll let you in one by one. And you don't need a camera. If you only have a microphone, or let's say you're camera shy, whatever it is. Pardon my throat scratches. I'm just getting over a bit of an illness here myself. So there is that link. And yes, the governments are your buddy, yes. So there is that link. We're going to go down now to the very next page, which is the secondary example of the heroic doctors and the bribes they could potentially receive if they would just vaccinate more of their damn patients. Now, here's... To make sure that you understand the incentives, they've given you an example with no change in threshold. So the very first time that they did the count in this second example now, they had 78 members. And in the secondary count, they had 83 members, which only grew by 5, which didn't change the threshold. It was still firstly 31%, grew to 33%, stayed in the same threshold, which means their payments did not increase. Tut, tut, tut. Doctor, you did not convince enough people to take the jab, so we cannot offer you that financial incentive. And again, the bullet points are here because the doctors are so busy planning their TikTok dances with their nursing staff that they don't do the simple calculation here. So they show you that the panel grew from 31% to 33%. But they stayed in the same threshold, that 30% threshold payment. They needed to get to 40% at least in order to grow their payment, as we did in this original example up here. See how they went from 31% to 42%. So they jumped from the 30% threshold to the 40% threshold. Their bribe then increased. However, in the secondary example, and I know I'm repeating myself, but I just want to drive this home. In the secondary example of the bribe that the doctor can receive for individually convincing people to get vaccinated, they didn't grow their members. The doctor didn't do a good enough job of selling the vaccine. and their payments didn't increase. They only got the minimum bribe of $1,500, which was $20 per head. And no, Laura, he doesn't truly believe that. Again, sarcasm. So there's the StreamYard link is there if you want to hop on, have your say. If not, we're going to wrap it up fairly soon. We are at the 20-minute mark. That's usually our key. I'm also going to put this in the comments. This is the document I'm looking at on the screen. If you want to check it out for yourself, verify it, share it with anyone else. That's the link there. You can certainly do that. It'll be posted on our pages as well. We're probably going to relook at this. It would be nice, yes, Elizabeth. It would be nice to have a Canadian whistleblower to verify this for the Canadian market. It's I don't know if it's against the law. It's definitely a quid pro quo situation, but I think it delves into something the medical professionals are quote unquote allowed to do based on the laws they're following. Now, again, it was all about, yes, Laura Lee, absolutely. I'll pop that up here quickly. So again, I'll reiterate, the document you're looking at here on screen is for Kentucky. I'm going to go back up just in case there's anybody new here. Anthem Medicaid, this is the COVID-19 Vaccine Provider Incentive Program. And the very, very important thing I want to read to you is the introduction paragraph. And Laura Lee, this is exactly what you're saying. They will prove it to you right here. Getting vaccinated against COVID-19 is one of the best and safest ways people can protect themselves and their families against the virus. As a participating practice in the COVID-19 Provider Vaccine Incentive Program, we recognize your hard work by offering you incentives for helping patients make the choice to become vaccinated. And then it goes on, of course, to detail here. There's two time frames, September 1st, 2021, and then December 31st, 2021. Two different periods that they're counting. And you can see the percentages here. If you manage to get 75% of your clinic vaccinated, you would receive as a doctor $125 per person. Imagine that. And again, before I leave, I'm going to point out that what they give you examples for the doctor, because this is a document for doctors. This is not for the patients. They break it down for you right here with examples and hypotheticals. And they even break it down under the graph in bullet points because